did like a deep dive into all things nerdery and science on ketamine, and we'll do a little bit of that today. But today our goal is to focus a little bit more on the experience, the sensation, the therapeutic impacts, the what can it do for me question. So again, I'm your host, Ashlyn, and we've got two guests here today with us. I'm very, very excited. They're both members of the ANU team as well. We'll start first with an introduction from Carolynn Redd-Recksiek. Almost Dr. Carolynn
almost
Redd.
Doctor.
Okay, how close are we? Days?
Long story.
Okay, we're close. The PhD is almost there. And then we will only be saying Dr. Redd-Recksiek because of that's what you deserve.
Or
right?
just Carolyn.
Just Carolyn.
Dr.
And you
R.
are our beloved therapist, one of the therapists that works with our patients.
Yes.
And we'll circle back to you and talk a little bit more about your background. And then Tia Johnson, our lead provider, who is a nurse practitioner and has been so for, I think, over almost a decade? Give or take. But also going to school to become a psychiatric nurse practitioner. Is that correct?
Correct.
Okay. So, moral of the story. We've got some highly educated women here that you are all going to be graced by their presence and hear all the amazing things that they have to share. So Carolyn, share us a little bit more about your background and what you do within ANU.
Okay, I'm a marriage and family therapist. For my clinical degree, my master's is in traumatology. And so, yeah, I have a full client load of treatment-resistant clients, suicidal clients, and then, helping and dealing with the people that, all of mental health impacts our relationships, so really putting a relationship spin on it. And here at ANU, I do ketamine-assisted therapy. So any of the clients that need a little extra support or are nervous or have an extensive trauma history, then I kind of go help guide the process, make sure that there's another level of safety, and yeah, it's pretty awesome.
Which we will talk all things CAP, ketamine-assisted psychotherapy, soon. But Carolyn serves an integral role in supporting our medical team and creating an environment, a safe container where our patients can really get the most out of these experiences. So we're happy you're here.
Thanks.
Is this your first podcast?
Yes.
Okay. We're going to kill it. We're going to
be amazing. It's going to be amazing.
Okay, Tia, tell us a little bit about your background and what you do at ANU.
So, as mentioned, I've been a nurse practitioner since 2015. Family practice, worked in primary care for a couple of years, urgent care. I've kind of done a little bit of everything.
Yeah.
And then joined the team here, coming up on a year.
No.
We're jumping the gun a little bit by saying that, but coming up on a year now.
Yeah, you're right.
I'm wishing for winter currently, so
Yeah.
coming up on December. I'm the lead provider here, so I have the privilege of doing all the consultations. I do a lot of the treatments, especially the first couple. Was that the full question?
Yeah, and there's other providers at ANU, and they kind of work under your leadership. And am I summarizing that right?
Yes.
Okay.
Yes, we've got a strong team of providers, and we, of course, kind of can consult, talk with one another, and we have Dr. Gilmore as well as medical director, who was on previous podcasts.
He was on there.
Had the privilege of meeting him.
The audience is very familiar with Dr. Gilmore now. So this essentially, to wrap it up, you're not only doing some of the medical administration, but you're also essentially determining if someone is a good fit.
Correct.
Okay, got it. So my thought for today is just to kind of follow the actual patient flow. So let's take it straight to the beginning, right? You've got someone who's like, I think I maybe want to do this. I think this could maybe work for me. I have struggled with my depression or my anxiety or my PTSD for a long time. I've tried all these other things and I just can't seem to find relief. They give us a call. They give ANU a call and they're like, hey, let's see if this is right for me. What does that process look like? Maybe Tia, you can kind of walk through what that first step includes.
Yeah, so let's say move forward, schedule a consultation. There will be paperwork.
Fun.
A little bit of paperwork involved. It's very thorough and in-depth, but it's all very important information that we need to make sure that you are a strong candidate for treatment. We go through the full intake during your consultation from start to finish. Make sure that, again, you're a strong candidate, a healthy, medically cleared candidate. Sometimes you won't get clearance on day of consultation. You will need to provide lab work or maybe see a provider for medical clearance. But then we're in close communication during that time, and then once we have what we need and we feel comfortable and confident, all of your questions, of course, as patient are answered as well, then we get you scheduled.
And I'm sure there's like a million variables and you can't account for all of them in a 30-minute podcast. But like when you think about traditionally a good candidate for ketamine therapy, what does that normally look like?
Yes, in 30 minutes that would be near impossible. So let me just hit on like some of the main things we talk about. Treatment-resistant depression, same thing with anxiety. You've tried, medications, oftentimes a number of, didn't tolerate them, they didn't work, your symptoms weren't well controlled. You've done the talk therapy piece. Still very important, very, very important with treatment, but, independent of other, ketamine, things like that, it just hasn't gotten you to goal.
Yeah.
Those are the types of things that we're going to talk through. So be prepared if you are going to do your consultation, your intake, really listing out the medications you've been on before. Why didn't they work for you? How long did you try them for? Those types of things. That information is really beneficial.
So do you have to have tried other medications to be considered for ketamine therapy, at least at a new?
Not necessarily. There are a lot of other factors that weigh into being a good candidate outside of medication. That one is just, I think a lot of times you'll feel like you've hit a roadblock in your, your health, your mental health, and oftentimes patients don't want to be on a daily medication, or there's a reason that they can't be on a daily medication.
Yeah.
There are other options.
Yep. And I imagine suicidality probably plays a role in your decision making as well. Like if that's a component of the patient's side effect profile that obviously we take very seriously, and assuming all other medical things are safe makes them a good candidate.
100%, yeah. So we're obviously trying to prevent, keeping patients safe. And if other things have been tried, it can be it's like the last ditch effort in a lot of cases for patients feel like, I'll try anything. Then absolutely, we're gonna, of course, make sure you're medically safe.
Yeah.
And if you're not at that moment, we're gonna try and get you there, see what we can do to make sure that you are a safe candidate, and then as quickly as possible, since, we wanna make sure you're feeling better, safe.
Yeah.
We would move forward.
And so medically, right, this is a controlled substance. And so it's important that the due diligence is done up front to make sure that this is a safe treatment for you. But there is the therapeutic side of this too, where it's like, here, you're medically safe to proceed, but are you ready to embark on this journey? I think journey is maybe the right word.
I like it.
Okay.
Journey's a great word.
It's a good journey. And we talk about this a lot of this is hard work. This is work. This is not a treatment where you show up and you get a shot and maybe you feel a little loopy and then you go home and you do it 6 times and then you feel better, right? It's hard work. And so Carolynn, from the perspective of a mental health professional, when you think about what makes someone ready to embark on ketamine therapy, what would you say that criteria looks like?
I think people are going to know instinctually. Especially treatment resistant, right? If you've been on multiple medications, if you have done talk therapy for years and years and years and years, and you are not feeling a shift, you're probably ready to do the work. You know how to do the hard work, and you just need a little bit of support. You need some help to move forward. If you know that you're a little bit off, if you know that you are avoidant of emotions or people or places, and you're hoping that ketamine is just going to be a quick fix, right? They can give me a little shot. I'll just sleep in a chair for a couple of hours. You're probably not ready for ketamine, because in a lot of ways, the kind of mental health aspect, right? The things that are keeping our symptoms stuck, it's almost like a boulder's been smashing us, right? And we're going to come to ketamine. Ketamine's going to remove the boulder, but there's still a lot of healing and repair that needs to happen afterwards. Yeah. And so, going into ketamine, recognizing it is a process, it is a journey, and ketamine doesn't fix our mental health, right? It can really reduce symptoms, but life still happens and we still experience the world. And so we have to do the work to recognize our mental health symptoms, know what our resources are, know what lifestyle changes we need to make so that we can maintain a better level of mental health. So for sure, knowing it is a journey.
Yes, and I always make a point in consultations to say, outsiders looking in, you get your injection, it kicks in 2 to 5-ish minutes. It looks like you are taking, not always, but oftentimes, the most relaxing nap of your life, right? But we know there is so much going on and then work to be done after your treatment. So we're not fooled by, the hour-long nap that it looks like you're taking while you're here.
Yeah, the single tear that rolls down the eye under the eye mask during this very long, restful nap.
Yes.
Yeah. So it sounds like, it's a process between, one, medically making sure it's safe, but two, like, the headline here is, if you're not ready to do the work, that's okay, right? Like, it's okay, but ketamine's probably not the right choice right now, because a lot of things get unearthed in an experience like this.
I loved the boulder. Yeah, the boulder. There was a saying that someone brought up a long time ago. I don't remember what context, but picking up rocks and looking for scorpions. So you're removing that boulder, you're getting that out of the way, but you don't know what you're going to find and what you're going to uncover. So work to be done.
Yeah. Well, and I'm sure you guys have probably seen this, like patients that come in that are like, I know it's not this. Whatever happens in this, I know for sure it is not this thing, because that thing's in the past, I've made peace with that, or whatever. Yeah. And I imagine it's the thing that always surprises you in those sessions, and you've got to be ready for the surprise.
Mm-hmm. But I also think for the patients, it's important that they're critical of who they're coming to, right? Yeah. If you're going to seek out ketamine treatments, not all clinics are made equal. And the fact that ANU from the start had a focus on mental and physical health, right? There's so much integration between mental and physical health. Physical issues can impact mental health can impact physical. And so the fact that both of that is being assessed, both of those things are being monitored before you are cleared for treatment says, we get it's a journey, but we want you to succeed, and we are going to make sure you have the tools and resources to have this be as effective as possible, regardless of what kind of those underlying core issues are that may cause you to have treatment resistance.
Yeah. So we say yes. All right, we'll use Ashlyn as this prospective patient and kind of carry this through our discussion. So, Tia says, I'm medically a good fit. I'm ready to do the work. I'm ready to commit to the process, trust the process. Let's now talk about kind of the prep work. What am I doing before I walk through the door for my first treatment? What are the things that I should be doing?
You're talking the day of your treatment, or?
Let's just say in general, right? Going into an experience like this, what are some of the things that I should be just preparing my mind and body?
Got it. Okay. So during consultation, we make it very clear whether a therapist's presence in the room is a requirement. If it is not out the gate, we always reserve the right to, at any point, hit pause and say, you know what, you would benefit greatly from having a therapist present in the room. Yep. And it is not to put up an additional roadblock or make things more difficult to schedule. It truly is. The focus of this treatment is on you, your success, Ashlyn, our patient, and how are you going to get the most out of it. Yeah. So if we recognize, for whatever reason, I'm getting ahead of your question here, but if we recognize for whatever reason a therapist present in room during treatment is going to benefit you, then that's what we're doing. So we talk about that during consultation. As far as before, we're going to talk gold standard here. Talk therapy, having a therapist ready to go and scheduling with them within 12 to 72 hours of your treatments, gold standard. So
why is that? This is a very specific window. What do those numbers mean?
Well, we can take so many tangents here, but neuroplasticity, that's when you're in that neuroplastic state, which
we're going to talk about.
Okay.
But maybe just give us a little bit of understanding of what that means.
Yeah, so you're in this more malleable state in that 12 to 72 hour window following. So that's what you want to use that time wisely, right? Talk therapy is high on that list. Really helps with the integration piece. And then back to your original question that I can derail 10 times over. Day of treatment. So we always say this is not something you do on your lunch break. You want to be ready to go, prepped. We always ask, Ashley, please come at least 20-30 minutes early to your appointment time. That gives you time to relax, decompress, take a nap, set your intentions, really whatever is going to get your mind right for your session. That's what you're using that time for. Oftentimes, patients will have a little debrief, pre-brief with their therapist prior to, like what is it called? Yeah. Prior to their treatment time, kind of help set the intentions for the day, things like that. And then fasting.
Physically, so there yes. are some physical requirements as well then?
Just a few.
Okay.
You will take your medications as prescribed, assuming you've had that consultation, that's when it's been decided upon. It's unique to you, but Ashlyn, you're not on any medication, so we don't have to worry about that. We ask that you eat something in the morning, easy on the stomach, and then really hydrate. So we've recognized that patients do a lot better physically, mentally, just feel better coming in hydrated. So up until 4 hours before your treatment time, you are pushing fluids. At the 4 hours, you are cutting off food and drink.
Got it. And you said as prescribed, so like if I was on an antidepressant or some other anxiety medication, like do I have to stop it to start treatment, or like what does that look like?
So it's not a concrete yes or no, but I can say typically we are meeting patients where they're at. So typically the answer is going to be you are taking your medication as prescribed. We're not trying to have you pause something. You come into your appointment and your anxiety is 10 out of 10 and we're like, here's your ketamine. Yeah. Doesn't make for the best experience. So we're very thoughtful with medications that are prescribed, how they're being taken, when they're being taken, and then when you're doing your treatments.
And then, I mean, is it possible to come off like antidepressants? Is some people stay on? Like, I mean, what's the goal when you for patients if they're on medications going into ketamine?
Sky's the limit, I suppose, but don't set yourself, you want to be realistic with your expectations and give yourself time, give yourself grace. If you go through your 6 sessions and you continue on that medication, that's totally fine. If you feel like you want to try and taper off and you go to your prescriber and you work with them and taper off and your symptoms remain in remission, that's great too. They're both wins. Yeah. Symptom control, remission is goal.
Mm-hmm. I think another thing too, like as you're preparing beforehand, I would clear some space afterwards. Everyone responds a little bit different to the ketamine, and some people are more tired. Some people need to kind of remove stimulus. Yeah. But also coming into the ketamine process, thinking about what you want your experience to be like, right? The rooms are beautiful. They're so comfortable. You have a nice recliner, you have a blanket, but there's also a chair if you want to bring, a support person. You can have the support person in the room. They can just wait out in the lobby. But really, who do I want someone with me? And is that someone that when I'm in a dissociative or a disconnected state, that I feel completely comfortable that they are going to respect and honor the experience, that they're not going to get triggered or upset if I accidentally start talking about a trauma in the room, and that they're going to help you have some time afterwards to rest and recover if necessary.
A trusted companion, which sounds like that has the right respect and energy for what you are about to experience. And
1,000%.
I'm sure as people are listening to this, there's immediately people that come to mind, and there's probably immediately people that they're like, I will never. And I think that's an important part of the process. Yeah. So the prep work physically sounds like fasting, hydration, which is no different than another medical treatment. Like, we want to do what we can to optimize physically the experience. This is a powerful drug. From a space, people, environment perspective, being thoughtful about what am I hoping to get, making sure I've got this space set up environmentally. I know a lot of patients that are like, I want to make sure when I come home the house is clean. If there's opportunities to remove certain stressors, I know those are gone, just so that I can be at peace when I come home. A lot of time patients, I think, book treatments in the evenings too, because it makes it easy to, which is back to your comment about it cannot happen at your lunch break. You're not going back to work.
Yeah, you're not.
Yeah.
And you're not jumping back into work when you go home.
Yeah.
That
certainly.
is not low stimulus.
Yes. So all of this preparation, I walk through the door. I'm here for my first one. I am nervous as all get, right? What are the next 2 hours? What are the next couple? What does the itinerary look like? What can I expect?
Well, knowing you, Ashley, and you came as directed
30 minutes
early. Thank you.
We'll start.
So one of the things we do immediately right when you arrive is we're going to give you Zofran. Should you opt in and choose to take it, you don't have any reason you shouldn't, allergy otherwise, right? Sublingual, melts under the tongue. We're going to get that on board right away.
Am I
Why, you may ask?
Am I throwing up?
Well, we're hoping to prevent that. So the fasting 4 hours before, we're trying to prevent that.
That makes sense now.
The hydration, same thing. Having something to eat in the morning, not taking the fast literal for the entire day, very important. You want to make sure you have something in your stomach in the morning. Easy, light, high in protein, healthy. Fasting the 4 hours, again, is to help decrease the risk, well known with ketamine, can cause nausea, vomiting.
Okay, I'm sure there's a lot of people that have the same fear as me of throwing up. Like, definitely. I would rather feel sick for hours than have to do that. So, I mean, it sounds like the Zofran helps with that, the fasting helps with that, the hydration helps with that, but it sounds like it's a pretty normal part of it. And I mean, like, I guess patients keep coming back, but like I assume this is something that maybe holds patients back from doing it. It's like this fear of nausea.
I'm sure it does. Don't let it. We do a low dose Zofran. So we learned so much from your first session. So after your first session, if we find out that low dose of Zofran didn't cut it, fasting 4 hours didn't cut it, we're going to have a debrief. We're going to talk through different options we have, whether it be maybe you need to fast a little bit longer. Yep. Maybe it was that heavy pizza you ate as your last meal versus, something like, we're going to talk through all of it. I mean, mistakes can be made, but we can also, well-known side effects, we're going to still work to combat them as best we can, control them as best we can. Yep. There are other medications that we can try, lots of different things, but yes, actually, it does not deter people, surprisingly enough, as much as it is just uncomfortable. People keep coming back.
It's normal, expected, and just part of.
Hence the Zofran being part of, unless again you were to opt out for some reason. Yep. The first thing you do, you walk in, you're taking that Zofran, so it has plenty of time to kick in and be ready to go for your treatment. So
I've got my Zofran. I am now. I showed up 30 minutes early to do what? You're going. Do you want to take this? What am I doing? What am I doing with this extra 30 minutes?
You're going to come in. You're going to again try to decompress. So there is a room in the back where it's just a quiet Zen room, so you can decompress in that room, or they will take you to your actual ketamine treatment room. Again, they're beautiful, comfortable. They'll give you a blanket, and you're going to sit in the chair. Take some deep breaths. Set your intention. Right? Ketamine is nerve-wracking. Your body's going to be a little bit. What am I doing here? But we want the body to be relaxed because we're wanting it to be willing to release what's causing your symptoms. And one thing that helps that is to set intentions. So coming into the room, there's a whiteboard where you can write your intentions down. Every patient gets a processing journal when they start, so you can start filling out your journal. The journal will have prompts for what intentions are, and you're going to just make sure that you are focused on the purpose for being here, not traffic was bad, what are the kids' appointments, that work phone call was stressful, this deadline. This is about me and my healing. And so really it's just kind of connecting back to self and helping your brain be ready to let go of negative thoughts or beliefs, or let go of pain that's been stuck in the body, or implant and integrate positive thoughts or progress and growth.
So doing the work.
Doing the work.
Doing the work.
Yep.
Okay, so I'm doing all of these things. The time comes, let's say I schedule for 4 p.m. Tia, I imagine you're coming in or someone on your team is coming in, and what is it looking like from there?
So, something we failed to mention, which likely would have taken place already, is the dose you receive is based off of your weight.
Got it.
So when you come in, we're going to have you quick step on the scale.
So you're weighing
get
every
that
time?
taken care of every time. Yep, just to ensure that the dose is appropriate to you, for you. And then we will take you into one of our 7 private treatment rooms. There are 2 chairs in each one of those rooms. The one for you as patient is a recliner. Talked a little bit about the companion piece. I don't know if we want to go into that more, but there's a second chair that is reserved for companion should you choose to have someone in the room.
Yep.
And then if you had a therapist present, then we would again make space. And we always say rearrange the furniture, whatever is going to make you feel most comfortable. If you want your companion sitting, chair right next to your treatment chair, holding hands, or just, knowing their presence is that close, then that's what we're doing. Same thing, therapists, move the chairs, whatever is going to work best for you during your session.
And then in our last episode, we talked about all the different ways to administer. Anu only does presently IM, so a shot. It's the way they currently administer. Soon to have Spravato, which is the nasal insurance covered option. Mm-hmm. But walk me through what the shot or shots look like.
Sure. So again, the doses are based off of patient weight, so they are specific to you, and we follow it's literature-backed dosing schedule. The doses will titrate up just slightly each time, depending on your experience, of course, how you're doing vital-wise, how you're doing too, of course, how you're feeling and experiencing things. And you have the potential to receive 2 injections every session. Okay. Reason being, so you said 2 hours, what are we doing with this time? We've kind of already covered the first 30-ish minutes. We're prepping, we're getting you comfortable in the chair, companion, making sure that they've got what they need to do their important job. Mm-hmm. We're setting you up with a monitoring device, which failed to mention that. We're going to monitor your vitals the entire way through. All of that's happening before you would receive your first injection. Kind of talking through, how you're feeling, setting up your intention board so that you're able to see it as
physically, like a physical reminder.
Yeah, those types of things. And then when it's time to proceed, you would receive that first injection, again, like a flu shot, so in that upper arm there, and it will kick in 2 to 5-ish, on average, minutes.
So fast. It onsets pretty fast.
Yes. So during that time, we're just ensuring your chair's where you want it, the lights, we've kind of talked through it, but sometimes it's like, wait, I changed my mind now that it's here.
Yeah.
We have eye masks if you want to put that on or bring your own. We're bringing in warm blankets if that's what you want, or, again, you're bringing your own if that's more beneficial to you. Comfort items. We're just making sure everything is in place and ready to go for the next 30-ish minutes.
So we're gonna have lots of words to describe these sensations, which is where we're going next.
Okay.
So let's just say for now, travel. Does travel feel like a good word? To maybe capture that altered, disassociative state?
I don't know if there's one better. Yeah, travel, journey. Journey's almost...
Journey, travel. We're gonna unpack this more, all right? What is travel? What does journey mean? But generally it's 30 minutes.
Yes, so you will receive that injection, typically, gotta use that word, typically it will kick in 2 to 5-ish minutes and run its course in 30.
Okay.
And I'm saying run its course. There is a lot going on while it is running its course, but typically it takes 30 minutes. And because we want you in that dissociative state for an hour of your session, you have the potential to receive 2 injections every treatment. If you receive 1, totally normal. If you receive 2, totally normal. You're not doing yourself a disservice if you only need 1 or if you receive the 2.
So it really just, you're gauging my response. Like, how long do I disassociate? And that's kind of our clue. And then of course comfort. Like, of course, if I'm not wanting to, then I'm not required to.
Absolutely. We need your buy-in, and you will be able to give us thumbs up, shake of head, verbal, yes, I'm ready. We're getting that before we're proceeding.
Got it.
And if it's not right at that 30-minute mark, you need a little bit more time, That's okay too. There's no, I mean, clearly your appointment's 2 hours long, but we're not like this strict 30 minutes up. You can't have it.
Yeah.
If you need more time, we're giving more time. So again, the experience is focused on you and how you are going to get the most out of it, how you're going to feel most comfortable.
Okay. So it's in my arm.
Did it.
What am I feeling? What am I experiencing?
Weird.
I mean, like, this is the big question. This is the big question.
Weird is the biggest word. I like, what are you feeling? It feels weird. It's weird.
I think that's the main one. Weird.
So your body's going to start feeling a little bit different. Patients often are like, whoa, like, like, do I have a hand, right? All of a sudden your body starts feeling different. Sometimes your mind goes to a different place. Some people are in a dark place. Some people are in a light place. Some people feel like they're traveling almost through space, or some people are seeing, different shapes, different lighting, things like that. So again, your response is going to be really based on who you are. It can also change every single session.
I do hear that it's different every time. Which is cool, but also scary, and that you're just like, I thought I knew what to expect, and then it just completely, took me somewhere else. Memories, like, I think some of the, like, if I think about the common misconceptions, right, and a lot of it stems from, it's recreational and illegal, I should say, recreational/illegal perspectives on it, and which are not rooted in fact or medicine or anything, but I've heard terms like K-holes, right? And things that sound really scary and not necessarily healing or therapeutic. So how does this become therapeutic? How does being in this altered state help me heal? Scientifically, in our last episode, we talked about how the neurons, we're getting new neurons that are developing, or neural pathways, I should say, and ones that maybe have been damaged by trauma and stuff are healing. So scientifically, we're getting the benefit of that. But therapeutically, these experiences...
Well, therapeutically, most things that are causing mental health is what we loosely call trauma, right? It's the hardships that we've gone through. And that can be physical trauma that, right, our body's like, whoa, that was really scary, that was too much. Or it can be psychological or emotional trauma. So one benefit of ketamine, it is a pain blocker, right? So you're going into that space and the ketamine's blocking the pain, but it's also exciting the brain. And when the pain is blocked, it's a lot easier to go through experiences, right? A lot of experiences get stuck in the body, and we hold on to that pain and the dysregulation, and it manifests in our body, right? Through physical symptoms and mental health symptoms. And so being able to reduce the body's pain response, or that trigger, helps the body do its natural process of healing. Our bodies are designed to naturally heal, right? And so if we can say, okay, it's dysregulated, and we can give you a tool that helps the body relax to start processing, then that's where it becomes therapeutic. Because all of a sudden the body feels safe enough to let go of things it was holding on to.
So this is why people say, like, 10 years of therapy in like 6 weeks.
Yeah.
And I imagine not every session is La La Land, or like, oh, this was the thing, okay, I let it go, I'm better. I'm sure it's not that formulaic. I'm sure it's a lot more messy than that.
As I was gonna say, it can be pretty gentle like that. It can be really, really messy. And that's why being honest and answering the questions in your clinical assessment is important, right? For some people, you are going to have things where it's just, oh, like, I went on this little journey, I didn't really know where I was, but wow, my anxiety's decreased, my depression has increased. Sometimes things surprise us, right? So we're in this dissociative state, and one of our scary, horrific memories comes up, and it is not just a clean, tidy, like, it's gone. People also can feel frustrated sometimes because they are expecting that it's going to be this really, like, vivid, like, I relived
like
this
the
trauma.
heavens open, and
But our body stores things in so many different ways. It stores memories in our muscles, in our joints, in our memory stores that are tied to smell or sound or sight or texture. And so sometimes the brain is processing things that we literally cannot visualize because it's not tied to that type of memory. And so it's really hard to trust oh, my brain knows what it's doing, even if I'm not aware of it. And there's so many things our brain does every single day that we don't overthink. But ketamine, people typically start overthinking, like, why did this happen? What was released? Why do I feel better? Why did this scary thing come up?
So if I'm capturing that right, it's almost like scientifically, irregardless of the type of experience, sensation that you have, you're getting the benefit, right? You're getting the benefit of the new neural pathways, the repairs, right? And so that should remain your focus going into this, right? I'm doing this treatment because the new neural pathways that I get is what is going to help me alleviate and improve my depression, my anxiety, my PTSD. But also, there is the potential to have these out-of-body experiences that allow me to revisit and process things that my subconscious feels like reminding me I need to do something about. But if I don't have that experience, that's okay too. And there's literally nothing you can do to predict if someone's going to have that or not. And so there's no reason to put worry or effort into that. And certainly expectations-wise, setting them low.
Yeah. So I think it's really important to recognize, again, it's going to be a journey. Most people do start feeling emotions a little bit more intensely after ketamine, and that can be overwhelming.
So what have you seen? Like, obviously not sharing patient names and data here, but like, what are the most common patient scenarios that you see reaction-wise while in session?
On the positive side, you see people like, I feel so safe, I feel so relaxed, I feel so good. On the flip side, it could be, I feel scared, I feel terrified, I feel alone, I'm reliving this. You see a whole extreme, and sometimes it bounces back and forth during the session. Some moments it's, that felt so good to let that go, I feel so safe. And then a few minutes later, it's, I don't know why, but I feel so afraid. So yeah.
And the wanting to bottle up the feeling, just the relaxation or the calm in those instances. And like you said before, the first 30 minutes after that first injection compared to the second 30 minutes after the second injection, should you need one, can be very different. Kind of like you said, okay, it felt really great that first 30 minutes. I'm ready to take on the world. And then the next 30 minutes, it can be a very different experience. And I want to touch on the different experiences, the visuals, whatever you're experiencing. If you are or aren't having, I really wanted to see bright, vivid colors and it was black and white, it doesn't mean it's not working. You're having the experience that you were meant to have with the medication. You have to just trust the process. And then the afterwards, I've had patients say that that was so abstract. I have nothing concrete, I have nothing to journal, I have nothing to write down or talk about with my therapist, so I probably just don't need to see him this week. It's like, okay, big time out. Sometimes there are those actual, very concrete, I was brought back, this memory came up, this traumatic, whatever occurred in my past, I'm going to talk through that. Perfect. But if it's very abstract and you don't know, you can't make heads or tails of it, you still want to journal all of it. Neuroplasticity, you still want to see your therapist within that, the next 72 hours because of that. So even if you're like, I don't have something to hold on to from that session and talk through, it doesn't mean that it's not still a huge important part of it all.
It's what am I trying to do moving forward? Anyone that's had mental health issues knows that you develop coping skills to tolerate or survive the annoying symptoms, right? So if ketamine's taking those symptoms away, well, do I want to just return back to that because it's habit? Or do I want to say, okay, this was what my behavior was when I felt really depressed or when I felt really anxious, and here's what I'm hoping to do in these situations in the future. So yeah, if you have an abstract session, your brain is growing and processing and healing and changing and letting go. But
that's exciting.
Just embrace it, right? And then, okay, therapist, I didn't have anything insightful. Here's what I'm trying to do in the future, right? We're going to try and strengthen the new roads that are being built, right? Because some of those mental health, depression, anxiety roads in our brain are pretty well established. And so we are literally going to be creating new roads, and we want those to be the most effective, the most used.
So trust the process.
Trust the process.
It really, period. It feels like while the science feels very formulaic and founded and evidence-based, each individual person's experience is just so vastly different. And you can't go in, if you've had a sister or a friend or whoever do it, and they tell you their experience, if you go in anchored to what their experience was as what your experience will be, you're likely setting yourself up to fail in some ways, because it's pretty certain that it likely won't be.
Yeah, I think it's a nice confidence boost to hear from someone who has had treatment and has had success. But yeah, you don't want to say, it's not like a Cadillac, I want that experience. It doesn't mean it's going to happen. It can be, again, very unique, different for you. And if you don't have the experience that you had imagined, it doesn't mean it's not working.
Yeah.
And I encourage all of my patients to make sure that they're focusing on safety, right? When you come in here, the building is beautiful. You're greeted by really lovely, nice, thoughtful professionals. You are in a room where there's a camera in there, right? So even if the lights are off, they can see what you're doing so that they can make sure that you are physically and emotionally safe. And then whatever the experience is, okay, I'm gonna just feel it's safe, right? And I like to compare it to people that like to run marathons. That's my favorite thing to do. I've done it, right? There's sometimes you go on a run, your body feels great. It's just like, this is so awesome. There's sometimes where you're like, oh, like my knee's bugging me, or my hip's bugging me, or I have a side stitch. And typically you push through that discomfort a little bit, right? You don't get scared by it. You're like, I think I'm okay. It's just whatever. You keep going. Ketamine's gonna be a little bit like that, where sometimes it's gonna be like, this is so great. And sometimes it's gonna be pushing through that discomfort, and then remembering this is okay, like this is what the experience is supposed to be, and it doesn't matter if there's some pain or some fear or some hard, or if it's really exciting.
It's all meant for me.
It's meant for me, and it's such a normal experience, just like running a marathon would be, right? We feel a whole extreme of emotions. We go through a lot of physical sensations running, and ketamine is going to do that mental health focused.
Oh, that's a great analogy. I love it.
So I come back 6 times. Is that normally like and I think a lot of people have questions too about like, I have to do this forever? Like, do I come back? How much ketamine do I have to do in my life before I feel better?
Well, it's anchored to literature, right? Evidence-based, the series of 6. However, right, there's always a unique to you piece. Yeah. So it really can depend on how severe your symptoms are when you come in, or oftentimes, and this is I'm kind of picking on something that's happened fairly recently, maybe the guard was up and a patient comes in very anxious, and I don't want to say that you can control the experience easily, but you do have the ability to kind of sway where things go and how much you can get out of it. The medication's you're gonna be fighting each other. So we've had instances where additional treatments were needed just because those first couple, it was just breaking that wall down, getting to the point where, again, the neuroplasticity is still working, but as far as like the therapy aspect, the talking through those types of things happened, they were delayed.
What were the concrete things that I needed to take from this to move forward, is what you're saying? Like that discovery comes later, and I might need additional sessions to really take advantage of the momentum to understand what needs to be done differently in my life.
Exactly. And oftentimes we love our therapists, we partner with them closely. A patient will have, doesn't matter how many, 1, 2, 3, 4, however many sessions, and then they go see their therapist. If their therapist is partnering alongside us in open communication, and they say they would benefit greatly from one more, we've just made this great breakthrough, we're working through something, we're being very thoughtful when we're having those conversations, because again, it is unique to the patient, all of it, all the way through.
And then I know we're going to talk about a particular case study of one of the patients that you guys partnered on, but am I good after the 6? Or let's say I came in, I needed a little bit more, let's say I ended up doing 8 sessions, like, do I ever come back? Like, how long do I feel that relief? Dr. Gilmore mentioned on our last podcast that based off of like the new clinical outcomes, looks very similar to what you would see in other literature or academic results, which is generally, 80% of patients reducing their symptoms by half or more by their last treatment, which is like mind-blowing to kind of think of. I mean, like, that's fundamentally a different life for someone.
Yes.
And that's so exciting to think about. How long am I going to experience that 50% reduction, right? Am I going to have to come back?
Everyone's favorite answer. It's unique to the patient. However, I'll let you take this in a minute. The before, the during, and the after, equal parts important, right? The integration, what are you doing with that neuroplastic state? What are you doing with the things that came up? Are you developing these new healthier habits? Are you using those pathways for good, right?
Yeah.
What are you doing with all the work that you put into it? We'll tag you in there.
Well, and I was going to say, it's going to be unique to you. But again, ANU has set it up to be, you have the ways to know, right? Mm-hmm. You can attend monthly group integration, right? Where you're going to get support pieces, you're going to get help knowing what to look for, what to notice. You get, all the mental health assessments sent regularly after your treatment.
So I know my score.
You know your score, and sometimes that score sneaks up on us without realizing, right? And so having that automatically feed into the email box, oh yeah, I'm going to just take my 60 seconds and go do that. Oh, my numbers went up. Okay, and then you can pull back, take it to your therapist. Hey, my numbers went up. Where do we think I'm at? And you know your symptoms, right? When you feel like garbage, you feel like garbage. And so then it's a really easy choice to say, I know that ketamine made a difference last time. I'm going to go in for a booster. Or you know what? I think I can work through this because something circumstantial is going on.
Environmental, something.
And so you know when you feel like garbage, and you know when you need extra support. But again, ANU provides that structure and the resource. It's not a guessing game.
So it demystifies how am I relative to when before pre-ketamine, post-ketamine, because I'll actually have a numeric score, which, there's a lot. Mental health is more, nuanced than that, but at minimum, an industry standard assessment that tells me, okay, if I went in with a depression score of 20, if we align to the research, then theoretically I'm leaving my last session, if I'm part of the 80%, with a score of 10, which probably puts me in a mild range, right? Mild. And if I see my score sneaking up to a 15, 16, 6 months later, that's a clue for me to figure out what needs to change.
Yeah. Well, and medically, kind of with the clinical studies, is it recommended 6 months after is a good time to have a booster? Is that kind of what the studies are showing, or is that?
It's kind of showing that that's the pattern, but it's unique to you. Yeah. So 6 months, 12 months, really, that's the beauty of those screenings coming out monthly. It's a pulse check for you.
Yeah.
Keep an eye on things. Or if you feel like something is off, you can take them as needed and kind of see where you're at. And then decide, okay, what did I do different? Oh, I stopped seeing my therapist. Okay, I better start seeing them again. That was really helpful. Or I stopped exercising. What did you change? You can try those things, adjust that. If that score continues to rise, absolutely. It's just another tool in the tool belt to see if a booster would be appropriate at that time.
And honestly, the thought of doing a treatment every, let's say, 6 months is on the lower end 4. And that's just one treatment. That's not the full series all over. Okay.
At this point, we're talking you've completed this 6.
Okay, so this is just a single treatment. Mm-hmm. For someone that maybe has been on antidepressants and the goal of coming off of them, 4 treatments a year, 3 treatments a year, as opposed to a pill every day, I mean, that sounds like a trade. Not to put stigma on medication, because there are some patients where it makes sense to, I imagine, to stay on it, but if that's a goal, then that sounds like a far preferable treatment plan, at least in my personal opinion.
Yeah, and we have a lot of patients coming like, I'm taking this because I feel so much better on it, but I'm dealing with XYZ side effects.
Yep.
The risks, the benefits, they're okay dealing with those side effects because they're feeling, better, but their end goal, that does make sense. You want to try and get rid of XYZ that you're dealing with, but still remain in remission, mental health wise. So, and anything health related, I don't even want to say like mental, physical, is not linear, right? There are ups and downs with everything.
Yeah.
It's not like you can just be like, okay, click save, I like where I'm feeling now, let's keep that moving forward. That would be a dream.
Right.
That's not the way it works. So it doesn't mean that you are, failing yourself or you're regressing and you should feel terrible about reaching out and, scheduling your booster or, talking with your therapist again. Anything, it's all part of the process. And again, tools in the tool belt.
Yep.
Reach for them.
I love it. Well, let's maybe close today's episode with, I think it's great to hear from experienced professionals, and a few Google searches and you can kind of see the literature is extremely compelling. But people love stories and people love to see it really work for people. And so wanted to end with one of the patient cases that I know you guys worked on and showing the results. This is a look at a patient that came through anew. It looks like they started their treatment in maybe mid-December or something, and they came in with a score of 20 out of 27. So by those standards, that is severe. And it looks like the suicidality flag was raised as well. So we've got concerns of, depression that is significantly impacting this patient's day-to-day life, but also experiencing suicidality. That feel like an accurate representation of that patient? Okay.
Many, yes.
Yes. And it looks like by mid-December or late December, which I imagine you guys take them at the halfway point, their score was at a 4.
Sounds about right. I mean,
which sounds
exceeds the literature.
Fabricated. Who's lying? And then by the end of their 6th one, they're sitting at relatively the same score. But what I feel like is most compelling is, this patient has done an exceptional job, it looks like, in continuing to take those monthly assessments that Carolynn was speaking to, but their symptoms have remained pretty far away from what their original baseline was. I mean, as early as July, sitting actually lower than what their end of series looked like. Now, of course, you could see, to your point, Tia, mental health has ebbs and flows, and this patient's no different, and you could see that there was, some changes in mental health, but that was likely a clue for the patient to figure out what needs to be done. I'm not sure if that patient got a booster or not, but regardless, by all accounts, this is a pretty extraordinary success story, right?
Absolutely.
Yeah. No, we're working with people that have treatment resistance, that literally spend years not functioning, not enjoying life, wanting to die, to have something. And again, sadly, ketamine's like everything else, right? 80% of people see success. There's going to be some people that it doesn't have that life-changing aspect, but to see people that are finally free of that fight.
Yeah.
Right? Like, oh my gosh, what? So, right, I've got a lot of patients right now that's what we're doing in therapy. Like, wow, I feel so good. I haven't had dreams and goals for years. My goal is to just stay alive each day and to see them
survive.
Say, like, I want to date, or I want to go back to school, or I want to travel, or I'm going to learn a language, or I'm going to take up art, or I'm enjoying relationships again, right? Like, I've rekindled a relationship with this family member because, like, I think it was just my mental health getting in the way, not that there was something wrong. Like, it's really, really cool to see people start enjoying life again.
Yeah, and Tia, I think you treated this patient yourself, and when you think about this patient, their expressions and things that, they shared, what stood out to you by the end of this?
I have the privilege of pretty much start to finish, right? So I do the consultations and I meet a piece of a person. It's 30 minutes.
Yeah.
There's an intake, so you kind of put things together. It is so exciting to watch every single session, just a little bit more of that person come back to life. And so at the end, to really see just the impact that it's made, the motivation to continue this too, right? It's really does kind of kick things into gear. Like, I don't have to feel that way. I don't have to respond that way, react that way. Like, there's there are options, which I think is a key word, options. You just learn there's so much more available to you. But just seeing someone, I don't have any other way of saying it, just open up, come back to life.
Yeah. It's a new lease on life. I mean, it's really inspirational. I had a friend who did ketamine, and the way that they described it after, aside from feeling significant improvements in their depression, they said it's like life all of a sudden had a wallet where I had all these different cards. I had AMX, I had Discover, I had all these different cards, and when a situation arose that would have historically been a trigger for this person, it was like the wallet opened and there was enough time for me to choose which card I wanted to swipe. And for them it was huge because they were so used to just grabbing that same card and swiping over and over and over to the point where, it was now harming them, right? Because that line of thinking, that reaction, that thought process, that coping strategy, whatever it was really starting to deteriorate their life. But now they had the option to consider other ways of thinking, doing, which I assume is the new neural pathways at work. But you just hear these really inspirational stories of people getting life back, and for some people, a new life emerging and realizing things that need to be let go and shed. But the people that are listening today very much went into this saying, okay, I'm ready to learn a little bit more about this. Their probably biggest question was around what am I actually going to experience, which I think you guys did a great job in giving us more information on. But maybe ending with your advice for someone who is in the process of thinking of whether or not this is right for them. What would be your advice for them?
Do your research. I would Google other ketamine clinics so that you can see that the product you're getting here is different than the rest. Know your purpose, know your intention for why you're even considering it. Because again, it is work, it's a journey. It also uses time and money, which are my most valuable resources. And try it, right? Like, if it's not for you, not for you.
Yeah.
If it's for you, then it can be life-changing.
Yeah, kind of the same. I always start every consult asking 2 questions. How did you hear about a new? And why are you considering ketamine? And it's nice because you can tell the people who come through and they're so passionate about what they've learned and they're excited about this, possibility. And it's okay coming in with like very little knowledge too, but just knowing that it's like, okay, someone got to this point. I saw someone else who had success. Perfect. Or I've tried all these other things and my therapist mentioned it. However you heard about it, it's like, okay, the door has been opened. What are you going to do with it? And then what she said.
Well, you guys have reaffirmed that there are people at ANU that genuinely care and are very passionate about this work. And I really appreciate you guys taking the time to walk through all the nitty-gritty. Hopefully those that listened in got a good understanding of what at minimum the ANU process looks like and what to expect. We will certainly be bringing you guys back for other episodes, so get excited for that. But thank you for tuning in and listening. We encourage you to subscribe and follow our socials. We'll include all the information in our bio. But we look forward to seeing you at the next episode. Thanks, guys.